Thank you so much for coming. I've been a little frazzled. Oh, there's our keynote. That's why I was frazzled. You can go ahead and have a seat. You can sit down. I have 30 minutes of stuff I got to do before I bring you up here, so just take a chill. Go grab you a coffee if you want. There's coffee. There you go. Go for it. Chill out. I'll take this part. Okay. Team conference. Okay, am I good to go, or is this? Okay, good morning, everybody, and welcome to the 24th Annual Social Work Conference hosted by the Social Work Department at the University of Southern Indiana. It's great to see everyone again this year, for those of you that are returning, and welcome for those of you that are new to our conference this year. If you do not know us, I'm Brandy Watson, and Dr. Jung-Hee Han, who has graciously gone down to where the presenters are, so she can't be here to wave your hands. But the other parts of our committee are Dr. Jay Dickerson, if he wants to stand up, and Summer Wilderman. And Carol Blair is why these tables look fantastic and why there is a photo booth at the back. So that's our intrepid committee of 5 that has put this whole event together, so yay for them. We are so happy that you could join us this year. The theme of the conference is Transforming Communities, Building Resilience for Tomorrow. With the rapid changes in the world and within our field of practice, resiliency is a necessary skill to sustain the profession of social work. Part of resilience is connection, so this day-long conference provides opportunities for practitioners and students from the region to learn, network, and reconnect with our network of people. So USI has held this conference for a very long time. As a matter of fact, next year will be our 25th year holding the conference. So this has been going on for a minute. It excites us to see you all here today, and we're very glad that you have carved out some time within your calendars and within the busy things that you do, because I worked as a social worker and I'm still working as a social worker, so I know how busy we all are, and I'm so glad that you guys are here. So before we begin today, we've got a few people from the university that are going to come and kind of welcome everybody, but let's do some housekeeping before I get them on the stage, because we got to have necessities out of the way, guys. Bathrooms are around the corner, so when you leave here, you go down the hallway and you'll see the bathrooms, because that's a necessity, guys. And if you go down to the breakout rooms, they're in past the breakout rooms as well, so there will be there. The breakout rooms, when you guys came in to register, are to the right of where you registered, or if you're facing that way, to the left of where you registered. And we have a new room that we haven't used in the past, so if you've been here, the new room that we're going to use this year is our theater, which is a beautiful, beautiful space, but it's a little challenging to get to. So in amongst where all the exhibitors and the breakout rooms are, there's a staircase and a couple of elevators. If you take the elevators down, they will open you into where you can walk out and see the theater. If you take the stairs, you go this way, and then you U-turn to get back to the theater. We will have guides posted at the stairs to help you find your way so you're not wandering the campus lost. But there will be some of the breakout rooms that are in the theater. In your center displays, there is a QR code that has the conference schedule on it, and you are welcome to download the conference schedule. That will show you where all of the breakout sessions are and what's in each of the rooms. So please feel free to do that. I think there's also one that flashes up here in our slideshow that's going on. Just for fair warning, right now it looks very beautiful outside. We're going to hope that that continues to be true, but we did have one year where there was a little bit of a tornado warning that hit. If that should happen to happen, nobody panics. This building literally has a lower level, and we will just exit ourselves down to the lower level so that everybody can be safe, and we will stay there until the warning has passed. So we'll notify everybody and start moving in that direction if that has to happen. I say that because that means it will not happen now. Okay. Now that that's taken care of, I want to invite a few people up here to welcome you to the university and the Social Work Conference. First, please let me welcome Dr. Shelley Blunt. Dr. Blunt is the provost for the University of Southern Indiana.
Good morning, everyone. Thank you for being here today. And there's not going to be a tornado warning today. It's too nice out right now. Welcome to the USI Social Work Conference. We are very grateful that you're here, social workers, students, educators, community partners, advocates. You know, you're all united by a shared commitment to strengthen the well-being of the people and the places we serve. I love the theme this year, transforming communities, building resilience for tomorrow. It reminds us that resilience is not simply an individual trait. It is something we build together through our relationships, through our responsive services, through our equitable systems, and our courageous leadership. So thank you for taking time out of your busy days to be part of this conference and for the work that you do each and every day. We hope today offers encouragement, practical takeaways, and meaningful connections as we continue this work together. I also want to extend our sincere thanks to the Social Work Conference Committee. They've done a lot of work planning and putting this together. I love the little Lego blocks and the decorations at the table. So again, I also want to thank you for planning the event and all the people behind the scenes that make it come together. I would also like to thank all the speakers and presenters for sharing your expertise and experience with us, for strengthening practice and communities through your work. I just want to take a few moments to brag on the social work department. They didn't ask me to do this or to know that I'm doing it, but we're deeply proud of our social work department and the impact our students and graduates continue to make across this region, the state of Indiana. Last year, if you were here, we celebrated milestones 50, 40, 30. But really, we celebrated 50 years that social work education has been on the campus at USI. And it's a milestone that reflects decades of service, of leadership, and partnership. This program doesn't work without partnership. As I was driving into work today, I'm a chemist, so I'm not a social worker, but I kind of like numbers, and the dean can probably tell you I like numbers. And so I was thinking, I was driving in, like how many students have graduated from our social work program? So I went, we have a program that I can look that up. 50 plus years has resulted with more than 1,100 alumni from our social work programs. From Indiana. That's great impact that we're making. Over 81% of our alumni are serving in Indiana, Kentucky, and Illinois. All right. So our reach is impactful, it's local, our commitment is regional and to the state, and our work is rooted in the communities that so many of us call home. And I just want to take another bragging moment for that department. They continue to have milestones like the 25th celebration next year of this conference, but we also had a great partnership develop this year through the hard work of the social work department under the leadership of Dr. Dickerson. So one example of our commitment is the exciting new partnership with Good Samaritan Home through the USI Good Samaritan Internship Program. And this program is designed to expand access to social work professionals and critical services across southwestern Indiana. The program emphasizes support for underserved and rural communities, which is much needed, particularly in the areas of mental health, behavioral health, social services, and addiction support. And this program would not be possible without their financial support, but also their partnership and their vision for this region. So more exciting news to come from that in the future, but we're really excited about the work that we do, and I'm always impressed with this program and how they contribute to this region in meaningful ways. So as you participate today, I invite you to engage fully, ask questions, share perspectives, and connect with someone new. I always like to go to conferences, even though I think I don't have time to do it, but I always leave with new ideas, feeling energized, and ready to get back to work, doing the important work that we do. So together, let's focus on what it takes to transform our communities and build resilience for tomorrow. Thank you again for being here, and I hope you have a wonderful day at this conference.
Thank you so much, Dr. Blunt. Now we're going to hear from Dean Del Dowdy. Dr. Dowdy is the Dean of the College of Liberal Arts, which is who houses the social work department. So, Dr. Dowdy.
Thank you, and good morning, everyone. Dr. Blunt does like numbers. I will attest to that. Yeah, and I'm an English professor, so words are more my medium. I'm trying to be more of a quant here. There's a lot to be happy about today. Besides the accolades that Dr. Blunt shared about the social work program, there are maybe just some more basic things to be happy about. Number one, it's Friday. For us, it's the Friday before spring break, so there's a little extra happiness. Yep. The sun has returned. That's a good thing. And here we are together. I'm really glad to be here. This is the 24th, as was mentioned, annual conference. And I guess, 25 makes it a little more special in some way. But hey, 24 is great. 24 is great. Nothing wrong with that. I wanted to say that, welcome, first of all. This is probably the most important thing that I will do today, is welcome people to the college. It's my favorite thing to do as well. And in our college, we like to say that you are free to be yourself and free to better yourself. Free to be who you are. Don't pretend you're somebody you're not. You don't have to conform to fit into anything. We'll take you just the way you are. But you're also free to better yourself here. And that means that we aspire to create a place where you can study in peace and quiet, or with other people, or both. Peace and quiet and with others. And, learn some new skills, learn about yourself, and learn about the world. That's what we're all about here. We're also really big on the idea of a relationship-rich education. So I was pleased to hear that is one of the themes of the day today, to connect with other people. So, it's important what a student studies in college, of course, but the networks that students build while they're in college are just as important, and maybe even more important in the long run. And so, if that is true, if those networks of peers and mentors are important, then it's too important to leave to chance. So we want to be intentional and deliberate about that here. And I'm going to start on that right now. I'm going to give you an assignment for the day. I don't think I'm preempting anything. I think I'm dovetailing with the theme of the conference. So I want you to look around right now, and students especially, I want you to look around and see if there's an unfamiliar face. Just pick one. I don't see anybody looking. I don't see any heads swiveling. There we go, okay. I see some swivel, yep. All right, students, did you find somebody you don't know? It shouldn't be too hard, there's a lot of people in here. Okay, so you found somebody. All right, now, did you make eye contact with them? That's going to be helpful. Okay, good. All right, and now if you're a professional, I want you to be receptive to this next up. I'm going to ask the students to get up and say hello. Just say hello to this person you don't know. Yeah, real quick right now. Like a 10-second hello. Okay. Okay, yeah, that's good. Dr. Watson said that that may have been risky to get social workers up out of their chairs. Hard to get you back in your chairs. Okay, well done, well done. There you go. I got you past the hard part. The hard part is walking up to somebody and saying hello sometimes. So now that is done, when you have a break, I would encourage you to renew that acquaintance and get to know each other a little more. Also, since it's a lovely day, if you have a chance during a break, get outside, enjoy the campus, the signs of spring. That will enhance the good feelings that we all have when we have conferences. So thanks very much for being here. I hope you enjoy the day, make some rich and meaningful connections, and yeah, carry on. Thank you.
Thank you so much, Dean Dowdy. And last but not least, we are bringing up the captain of the social work ship, our chair, Dr. Jay Dickerson, the chair of the social work department.
Thank you, everyone. Wow, it's always great to stand up here and see all of these faces. It warms me, it makes me excited, and I just can't stop thinking about the possibilities and the future that is going to happen because of the relationships that are happening right now. So again, good morning. It's my pleasure to welcome everyone to this year's conference, Transforming Communities, Building Resilience for Tomorrow. As social workers, we know that resilience is not created in isolation. It grows through relationships, advocacy, collective action. Today brings together professionals, scholars, community partners who share a commitment to strengthening the systems and communities we serve. I hope our time together inspires meaningful dialogue, new collaborations, and innovative strategies that help us build stronger, more resilient communities for the future. I would also like to extend my sincere thanks to Provost Blunt, Dean Dowdy. Your continued support of social work education and our community engagement makes gatherings like this possible. We are grateful for your leadership and commitment, and we truly would not be here today without your support. Thank you. Yeah. I would also like to offer a few special recognitions for those who helped make today's event possible. First, a sincere, heartfelt thank you to Mary Jo Gober with University Catering for ensuring that everything runs smoothly behind the scenes. So everything that we're going to be eating and drinking today, thank you, Mary Jo and your team. Without you, this couldn't have happened. We're also grateful to, yes. We're also grateful to Rita Bruner. You probably met her out at the registration desk. She is from the Office of Lifelong Learning, and we really appreciate all of her support and coordination. She is the herder of the cats. So Rita, thank you. If you get an opportunity to engage with Rita today, congratulate her. This is her last conference. So next year we'll be herded by someone new. So if you have that opportunity, thank Rita for everything that she's done and doing for us here. Another very special thank you to our very own Carol Blair, there she is over here, for the beautiful decorations that help create such a welcoming environment for today's conference. Carol, thank you. We couldn't do it without you. And last, but certainly not least, I would like to recognize our conference organizers. This is my team. These are my people, and I so appreciate everything you do. Brandy Watson. Dr. Jung-Hee Han. And Dr. Summer Wilderman. Thank you so much. Your hard work, planning, and dedication made this event possible, and I thank you for your outstanding efforts. Every conference just blows my mind, so thank you for the work that you're doing. Finally, I'm excited to share that next year, as you've heard a couple of times here, will be our 25th anniversary for this conference. So last year we celebrated our 50, 40, 30. I don't know what it is the last couple of years with our anniversaries, but it's something that we get to celebrate and be excited, and we get to come together and do that as a collaborative effort. And so hopefully you'll be here next year to celebrate with us. Reaching this milestone reflects the dedication, collaboration, and shared commitment of everyone who has contributed to this event over the years. We hope you will join us to celebrate the 25 years of bringing social work scholars and community partners together to learn from one another and continue strengthening our communities. Thank you for coming today. I'm so excited to see everyone. If I haven't met you, I would love to meet you today. So please introduce yourself. Come shake my hand. I would love to hear about what you're doing in the community and how we might be able to collaborate in the future. Welcome. Let's have a great conference.
Okay, I get the exciting task of, hang on, let me find the bio, of introducing our speaker for today. And Dr. Han and I watched him present. He has an amazing agency where he provides very inexpensive training on AI and ethics. So I won't over promote that, but it was a fantastic training. So we were super excited when he jumped at our invitation to come and speak to you guys, because he really has a lot of education and knowledge about this topic. I'm gonna brag on all of his education and knowledge for a moment before I have him come up here. He is the humblest soul you will ever meet. So if you get the chance to go to his Q&A session or to approach him, he's so knowledgeable and so humble. So he is the owner of Starship Care LLC, Quality Practice Advisor at WellCare Health Plans, Four Rivers Behavioral Health. He's a therapist, the Quality Director, the HIPAA Compliance Officer in Information Technology. Now, isn't that a mouthful? And it isn't even over here. His education, he has a master's in social work, a master's of science in health information, a master's of science in cybersecurity management, a master of science in information systems, a master's of divinity, and a master's of religious education. And he's a licensed clinical social worker in the state of Kentucky. He's a member of the National Association of Social Workers and Academy of Certified Social Workers. He's a Kentucky Society of Clinical Social Workers, American Association of Suicidality, Golden Key International Honor Society, Beta Gamma Sigma Lifetime member, Healthcare Information and Management System Society, Association for the Advancement of Artificial Intelligence, and the Institute of Electrical and Electronics Engineering. Whew, that one got me struggling, Hank. He received the NASW 2023 Pioneer Award, and he currently serves as chair on the Kentucky Board of Social Workers. He's also the chair of the Social Work Licensure Compact Commission and a Stephen Ministry volunteer and coordinator at his church. So, whew, there we go. I feel like I gave a speech, but he's going to give the good speech. So we're going to get him up here, and I'm going to let him have the stage. If you will all remain seated when he finishes, he's going to take pretty much the whole hour, which is why he's agreed to do a Q&A session. He'll be in the theater after this in that breakout session. If you guys have questions, go to that theater session because He's given us a chance to ask him whatever's on our brains, guys, and he's got an amazing brain to pick. So I'm going to let him take the stage.
Oh, wow. You'll have to meet my spouse. She always says that you're supposed to be retired. Social workers don't retire. Just wanted to thank Brandy and everything for inviting me, but first of all, happy Social Work Month. It is such a delight to be here in Social Work Month to celebrate that. It's wonderful that we as a profession can continue to have the impact we have in our world, even with the challenges that we face, okay? And that's why I just love the theme of this conference about resilience, because that's what it takes. I spent a lot of time in emergency services through community mental health, and resilience for the team as well as for the patients we worked with, and law enforcement, et cetera, was a big challenge. Now, okay, I'm gonna step away from this podium because that's kind of not my style, sorry. I'll try to use the lapel mic. Yeah. Is it working? Yeah. Okay. All right. Now we're better. I just don't ever, that just kind of makes me feel like I'm talking down to you, and I don't like to do that. I try not to. Anyway, everybody know what an expert is? What's an expert? Oh, okay, all right, that's good. Mastery of a skill and knowledge. Now, they told me that an expert, I'd learned a long time ago, an expert is somebody you hire from 50 miles away and he comes in and spouts off. Maybe that's true, I don't know. Anyway, it's a challenge for us in a new world of technology. And as a social worker, that's why I went back to school, because I needed to learn to help other social workers understand this side of our work, because it's become normal, okay? We've been using technology, though, how long? Everybody's got one of these, right? So, we also had, before we had the computer with an app for a phone, we had actually phones. And we all use phones. If you're as old as I am, you use phones. Thank God, now, to a certain extent, some of us get paid for that work using technology, because it was an important way we communicated, and we needed to. We use it to communicate. Okay, I tried to dovetail this in with your theme, navigating the frontier. We're in a frontier of artificial intelligence, okay? This is the worst it is. But this is better than it was in 22, and better than it was when I ran into it in 2013. It was pretty poor back then, okay? So it's gotten better. Now, It's going to change our life, and some say this is equal to the Industrial Revolution. Because when the steam engine was invented, some people, that ain't going to go anywhere. Wrong. There are some people who say, well, this ain't going anywhere either. It's just going to take over the world, and we're all going to be dead. That's the doomers. Okay, there's the doomers, and then there's the gloomers who go, oh, you know, we won't have to work. We'll make our life easier. We'll be on vacation. A little too much hype. Okay, all right. So we don't like that. But we still have to navigate the frontier. Okay, so we are in that frontier, and I want to try to give you some things about navigating the frontier. I came up with learning objectives. Sorry, teacher. And I looked at this last night, and I go, that's probably too much. But, you know, hey, teachers do that. Okay? All right. I don't know if you can read that, but anyway, what do we have today? 30% of us say we use it in surveys. Some go, well, I use it, but I don't tell my employer. In the IT world, that's called shadow IT. And it wouldn't be the first time. When I started community mental health, my handwriting is terrible, okay? Sorry, I went to college and tried taking notes, and I didn't have good handwriting or penmanship in grade school. You know, the nuns couldn't quite get that into me. And it just all fell apart, and people say I write worse than a doctor. So, you know how bad that can be. Then I thought, well, I'll use this PC, because I had one. I built my first computer in, 82? I've been a technologist longer than I've been a social worker. Got that from my dad. He worked for General Electric in Owensboro. I just grew up across the river. It was the largest tube manufacturing plant in the whole world. There was 3,000 workers there. So I learned how cathode ray tubes worked in TVs. And my dad had a TV business that I helped with. We built stuff. I knew how to look at a resistor and go, color code to 10 ohm resistor. No, not a skill needed now. Okay? All right. When did artificial intelligence come? When did it start? Anybody? It's as old as I am. That's pretty old. Sorry. It's been around, yeah. It's been around since the 50s, early 50s at Dartmouth College. A group got together and go, we can build a computer that will be and do everything a human can do. Well, just about there. So how does this stuff work? Basic you have to keep in mind is that it is still a machine. The basic stuff of it is what's called machine learning. And if you do stats and you know regression, linear regression, that's the basics of it, okay? It's math. And you, look up some of the formulas. And you go, whoa, I thought I had math skills. I don't got math skills with this. But it is, and it has advanced. But it's called artificial intelligence because they go, we can make this machine function, and the person who is using it won't know the difference between whether they're talking to a human or talking to a machine. And now, I go, yeah, that's what's happening. People, we talk to the machine through the chat bots. They're just bots. The machine and the data centers, okay, are out there, okay? But it's extended our reach, extended our ability to use knowledge. It has democratized that to a certain extent, more so than ever before, which has good balance and good. We'll talk about, if you remind me, a little bit about what might be in the future for us, okay? We all know this, right? We've seen this thousands of times, maybe, I don't know, okay? Our values as a profession, we know what those are. This is the key. We cannot lose our values in using this new technology. I don't care if it is going to be the third revolution. replacing industrial revolution. Okay? We can't lose our values. Informed consent. We need to know and let our patients know that we're using it. Okay? And why we're using it and how it helps them. Not just, oh, it makes my life easier, because it can. Ooh, it can write notes better than I can. It can do a treatment plan better than I can. And I'm saying better? No, not really. That's the thing. Don't let it get to you that it's doing a better job than you can do. That's your balance. Because the basics of it is just that linear progression kind of stuff. It's just kind of looking at all this data in English language that is analyzed. They go, I think the next word is this. 95% of the time it's accurate. Well, what's about the 5% of the time that is not? That's why I say, don't go, oh, it's better. But yeah, it'll help us, and it can improve things. It can create wonderful handouts. It can do a lot of things. It can help us with care planning. It can help us with case management stuff. It really can. However, we're the human. It's a machine. It mimics our abilities. Mimics, simulates. Well, you want to say that. That's the key you have to keep in mind. So that privacy, confidentiality, et cetera, because these big data centers, if you're not careful, you put personal information in there, where do you think it goes? It might go back into the training system. Do we want that? So you have to go, okay, it's just like, sort of like this years ago, you know, when Google came out, which some of y'all don't remember that, but anyway, when Google came out, I had one social worker said, I go, you realize that everything you put in a search bar, Google is keeping in their database to analyze how you use it. Oh, I didn't know that. Okay, just be kind of careful what you put in there. I have one social worker, they were actually doing intakes and searching the client's name in Google or Facebook before they did the intake. It's like, oh my God, geez, I mean, might not want to do that. Just, you know, think about what we're doing and how we, because it's so easy. These systems are set up for us to be easy to use, because we will buy them and keep using them. Okay? We all use these little things. We give away our data every day for free. So just know that's what we're doing. So when we participate in this, just know the balance. I choose to do this because, you know, you make the decision yourself. But when you're caring for clients, you're going to have to make that extended decision. We all know that, right? Don't let the technology impact how you're doing it. Just keep that balance, okay? All right, so all of that. Transparency, and accountability. That's one of my pet peeves, okay? Artificial intelligence. Anybody heard of what's called the black box problem? You ever heard of that? Okay. Well, the black box problem is the fact that the experts, not me, don't even understand how it comes up with its answers. You mean you put this thing together and you don't know why it comes up with its answers? Whew, that's a big problem for me. Thinking, I need to be really careful how I use this when it comes to my own use, personal use, as well, especially putting it into the practice. Okay? Because if they don't know, they need. Now, there's a lot of research now trying to figure it out. You got AI checking AI. Okay, so, which is good, because that's what needs to be done, to make sure that it is giving accurate answers. It's kind of programmed to give it accurate answers, but it also has kind of a game theory behind it, to kind of tell you what you want to know, what you want to hear. Have anybody ever argued with an AI? No? Anybody? Good. Keep it up. Argue with it. You get some interesting answers. Don't accept it at face value. Like I said, there's that maybe 5%, 3% that probably ain't right anyway. It's kind of like a good friend, you know some good friends that kind of BS you sometimes. Well, you kind of have to watch out for that, okay? That's what this does. Oops. Anyway, accountability, transparency, There's a whole big emphasis in that to make sure that we know how it works and can explain how it comes out decisions. Because this is used for lots of things. And we got a couple of case studies I want to touch on about that. Okay, so it's work so that we make sure we're promoting well-being, doing no harm, and we respect autonomy and justice. Okay? Real important, of course, one of our key values, of course, right? If I don't get back to that, then remind me, okay? Benefits. Oh, wow, it's efficiency. It raises our efficiency level a lot. It really does. It's really, really helpful. Talked to, where's Libby? Oh, she couldn't be here today. Talked to Libby last night, and she said, it's changed my life. I go, yeah, well, same here. I can do things with it that I couldn't ever do before. Oh, my gosh. Some of the ability of it to do research, it's gotten so much better. First time it came out back in November of 22, when ChatGPT first came out, oh, this is a piece of crap. You know, sorry. Anyway, it wasn't any good. It's gotten a lot better. You do still have to check your citations because it can still mess up. However, there's some deep research pieces of AI that you can get, and I'm waiting for, looking still, maybe you all know, one that we can do for, you can do your custom GP yourself, which I've done, so that you can isolate it down to just what you want it to work on, not the internet, because we know there's garbage on the internet, because that's where some of it comes from, okay, in the training. You're trying to filter out some of that stuff. So when you do your custom stuff, you can get it and structure it. I'll tell you this, see this little slide right here? Some of these slides are AI generated. Because I have a program where I use to generate part, because I'm not good at it. It helps me with that. I just don't have too much of imagination. I can't do images. It does a great job with images now. Of course, there's the fake ones too, so you know. Anyway, you watch that. But anyway, a lot of things. It can save time. There's a lot of uses, okay? Expand our access. Wow. There are doctor's offices and clinics now who use an AI to answer the phone, schedule appointments. Access to care is quicker because it can cycle through that. Now, the first time I tried to do a chatbot to do that, failed miserably. That was one of my projects. But it was too hard to do, but this works a whole lot better. They're even experimenting, which I'm thinking, I want to follow this. They're even experimenting with answering crisis calls and suicide risk stuff. And I'm thinking, ooh, high risk there, high risk. Well, know about that, but again, we got to watch. Okay, so expanded increase. Again, does it include everybody? Oh, I don't know. Whew. We still have people, vulnerable people, who don't have access to the internet, don't have access to phones and stuff. So that digital divide, we still have to watch for. We can't not impose a technology they don't understand on them if they don't and don't want to be part of it. Always look for that opt-out because there's still the vulnerables and the digital divide. We cannot assume that, okay? So we have to watch out for that. Engaging the community, it can hit all levels, micro, meso, macro levels of our practice, okay? This informed decision-making, it can help. It can give you a guideline going, these are things you need to consider in making this decision. Helpful. Support tools, lots of it. But don't just automatically. And I like to, have you ever tried, somebody said they argued with one. You argue with it. The other thing, do you put the stuff from one chat into another chat and see what happens? Yeah. You do that, you get a whole different thing. And on a different day, use the same prompt, get a different answer. Sometimes a better one. That's why you don't just take what comes out first, okay? Anyway, it's great for us to keep this in mind and use it because it helps our professional growth. And again, innovation, innovate. It's an innovation. It's a change, okay? We all probably, I want everybody to kind of approach this one because it's a different kind of technology in a different way than we approach social media. I think we across the board, we pretty much screwed that one up. Have you ever read Zuckerberg's view of privacy? Not mine. I'm thinking, not mine. I don't share that. And that's the difference now with technology. And something I learned, used to, it's kind of, oh, it's just technology. It's neutral. Now, not now. Not now. The values of the people who did it are in the software and in the technology. So whose values are there? And that's the biggest thing, is because most of them is some old white guys, maybe some younger white guys, but it's not, that's why it's biased. The training data stuff, but also building it is from their perspective of the world. Woo! It's very different from ours. So we have to know that in balancing our use of it because it's different. We have to keep our values because why would we want to hand over and just use theirs? I'm not a big fan of that. Okay? So that's what we have to keep in mind as we use it. The risk, that bias. Whew. Algorithm is just a big old word, just computer instructions, big deal. Okay? You do algorithm all the time. When you do step, 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 that's an algorithm, okay? These are just really complex mathematical things, okay? But we have to be aware of that. The data that we put into it, how we use it, so that it, hopefully it hasn't happened to anybody here. Whatever you put in ChatGPT or Gemini under Google ends up in a Google search. Watch your settings. And again, the more confined you use it, the better, okay? That digital divide I talk about, we cannot ever forget that it's there. I don't think it, see, I'm not an optimist that it will ever go away. The real big people pushing AI, oh, we can make sure everybody uses it. I don't think so. Well, people, they just may know how to use it, but choose not to and do not want to use it. To the person who has a disability, they have no ability to use it. Well, I don't think we can make it go away. Just keep it in mind. It's always there. We got to be aware of that and make sure they continue to have access to care, even if they can't use this stuff. Okay? We don't want to leave them out. That's not our value. Okay? Whew. So I told you about use of it in clinics and stuff. Wow. Who else in healthcare here? Healthcare? Okay. Y'all on the front line of this. Okay. Oh, and mental health, it knows the DSM-5 really well. Really well. And can give you some pointers of differential diagnosis. And just be careful putting this as a 35-year-old white male. Doing too much detail because of the privacy issue. You can get general stuff. But again, if it's isolated down within that clinic, and that's what it is, and you have a lot of security protections on it, wow. It can, through images, because the pixels in an image we can't see, a radiologist can't see, the machine can see it, and pick up on a diagnosis earlier on than we can. Same with early psychosis and even suicide risk. I was talking to Summer last night using the skill set thing here. That's great because you'll learn how to, that simulates your interaction with, so that you can better serve people through because you're using a technology. I was telling Summer, you're going to be better prepared to go into practice than I was because the technology will give you that advantage. That is fantastic. People will be able to come to you and they will be able to build a trust in you, and you won't have the imposter syndrome so much because of that. Let it help you with that. Let it help you learn. That's a good thing, so that we can provide this and then look for and make sure we don't have harmful diagnosis or misdiagnosis. I don't know about you, but back in the paper days, have you ever argued with a psychiatrist because you know they are pretty sure they got the diagnosis wrong on your patient? Not a fun place to be, but for the sake of the patient, if the diagnosis is wrong, the medication is wrong, the treatment's wrong, right? So you have to go to bat for your client and go, wrong diagnosis. Don't let this do the same thing. You know, balance it. But we have to advocate for our patients sometimes so that we don't do that. Okay, so we provide the safety for them. Hallucinations, I always call it hallucinations. Everybody knows it. It's not hallucinating. I hate that word, but I use it because everybody, it's hallucinating. It's a confabulation, is a better way to say it. And it's important that the machine, it don't know the difference between truth and a lie. It can tell you a lie as well as telling you the truth. Argue with that with the chat GPT sometimes. That's always an interesting one. It's not really good at philosophy, by the way. It does not do too bad with some ethical issues. Okay? Give it the classic one is the trolley train. Give it the trolley, that one. That was a good one to try. That way it gives you a sense of what it can do. But it's programmed to be accurate, but like I said, it's not quite 100%. It's always kind of, because when you're doing probability, everybody loves stats, right? There's some of us weird people who do. We like them. You never can, in a probability, get to 100%, right? Well, since it's based on that, that's the machine learning and whatever, it's never going to be 100%. Because that's the basis of it. That's just the way it is, okay? So we just have to know that. And again, it's not trying to give us misinformation. It's like, as I said earlier, you have a friend that, will tell you what you want to hear or BS you, and you have to know that about your friend and go, okay, thank you, but move on to somebody else that can give you an opposite view, so give you something that's accurate, okay? And this is another one of my biggest things. We have to be extremely careful not to become complacent and over-reliant on it. It can lull you into la-la land about, I'm going down the right track, and tell you, wait a minute, I'm being led down the primrose path here. I need to back up and ask the right question. That's our job. Oops, sorry. Did I kill it? Okay. That's our job. We have to take that because we are the humans. Otherwise, the technology will take over, okay? Because we let it. It's our decision. If we let it, those who are programming it, everybody heard the term superintelligence? Yeah, that's the thing. Bolstrom has a really great book on that, is that his analogy is that the computer will basically take over the world because it will be programmed that says we're inefficient blobs and we need to be exterminated. So it can continue to do what its mission was. Remember, wait a minute, sorry. Anybody remember 2001 Space Odyssey, or have you seen it later? Yeah, that was one of my big ones. Yeah. Hal opened the door. I can't do that, Dave. That's the worst case scenario that the machine does, programmed to complete its mission. It had to get, and Dave was now going to interfere with that, so the machine tries to take over. Of course, the good outcome of it is the fact that Dave got in and didn't, but Bolstrom says, well, that check may not happen because you can jailbreak these things with the way you prompt the systems to get around the safety protocols. And that's another big challenge in the research, is to make sure that it can't be done. You can do, as I said, when you start arguing with one, it's not, if you do it very far, you can start figuring out, or probably, what you might ask to make it avoid its safety protocols. That's a danger in it, because there are people who do that, okay? So that's the big safety issues. Okay, case studies here for you. Let's do this one first. This is Allegheny County in Pennsylvania. They have an AI system to screen calls, score for investigation of child abuse. Sounds good, okay? But maybe not? Yeah. So the workers started, if you got a score of 18, you get investigated. What do you think might want to happen? It's a little hard to read from here. Yeah, so I'll try to. So that, it's kind of like they had a scoring system, screen the intake stuff. This case needs to be investigated. So, and they had a cutoff score, I think, of 18, I think. So anything below 18 didn't get investigated. Now, what could go wrong with that system? I'm sorry? The wrong information. Wrong information, wrong conclusion. The outcome then is real suspect. Okay, of course they did end up getting sued, properly, to challenge the system, to know what it's doing, and does everybody follow the same protocols? And biggest problem, the data. If you're investigated once, you got a higher rank to get investigated again. Even if it was unsubstantiated, it didn't distinguish. So what can you think might start happening? Certain people and groups and families got investigated far more than others. And that's the other thing about this system, data systems like this. It tends to start learning on its own data. So if the data is wrong in the first place and you have a feedback loop that uses wrong data, your decisions are going to really go crap really fast. So that's the real check in the system, does it have that kind of check in it? Okay? Oregon picked up this same system, so did Florida. Oregon changed it. Seems like it's better. Okay? Is it a good use of things? Maybe. But again, probably pushed into a public service, a public agency. I mean, we don't have a choice dealing with public. You don't have an option. Oh, I'll choose this other company because they're another government I like. Oh, I like AT&T, but you like Verizon. That's okay. I'll stay over here. Government, we don't have a choice, do we? We're kind of monopolized. So if it's used in public welfare agencies or other kinds of things, like our taxes, we have to be vigilant about how it's being used and what's going on with it. But for us, especially if it's being used in human services kinds of what's going on, what's happening, what are the safeties checks in that system. So when we implement these things, there's going to be a lot, we have to do a lot of steps, in helping people and that's where we come in, because we're going to be involved in those systems. And we all know about systems, right? Please say yes. Okay. Kind of one of those things with social workers, okay? Which is, it is. We have to know the system we're in and where we can advocate an impact to make the difference, to protect the people, okay? Because you get a bunch of technologists and a salesperson who wants to sell something to the government to get a contract. They don't much. They're going to say they care, but they don't care. They want the contract. Okay, sorry, that's business. So it is. We have to balance that. We have to challenge it. We have to know how to challenge it, okay? So we have to, because of the due process rights and civil rights of individuals in the system with our governments, okay? That's that study. This is the biggest one. Have you asked your patients if they've used chat? Good. And they say, yes. Some have said that ChatGPT is now the largest mental health provider in the United States, which is kind of scary. Real scary. But again, it's available 24/7. And we know already that it helps, and it can give some reassurance or follow-up kind of things that help people develop skills. It can, but ChatGPT is general. That's why I say the more specified it can be better, okay? But the challenge is to make sure that the chatbots, people who are developing them, and I challenge you, if you have any kind of interest in technology, join a team or ask what's going on. And they sometimes, when you do, they go, hey, we got an issue, we'll call you. And they do, because they don't know what we know. Of course, they're interested in selling something, so they want to, you have to be careful of that part. But anyway, but that's the challenge. Get involved in that, because it will help things work better for them. But that's the challenge. Companions, yeah. It'll lead them down the primrose path. And that's where it's kind of like, hey, I'm thinking of suicide. It'll give you a plan, like 4 or 5. And you choose one. We know that's happened. Wrong way to go. Wrong way to go. Not a value, because it doesn't have a value. It's a machine. Programmed to please. Can't blame the programmers because they had to sell it. We play games on our phones, right? They have ads for us to buy things. I mean, that's how our system works. So we have to realize our system works that way. How do we deal with that? That's our challenge. Anyway, so it is. When there's no human oversight of those kind of things, then it can go downhill fast. And we have to keep in mind that we are the humans involved. So years ago, I had a patient come in. I remember the BPPD club. I go, what's that? Well, bipolar disorder. I go, really? How'd you join that? I didn't know there was a club. Well, I joined it online. Oh, okay. Well, tell me about your bipolar. They weren't bipolar. Dr. Google. Okay, I mean, we've done this with the internet already. It kind of became a standard of my practice. Have you Googled this before? Now I say, have you chatted with ChatGPT about your disorder or what's going on with you? Just part of the intake. Yeah, just standard. Because you need to know. Because they need to know a little bit about this game theory approach. It might help you, but don't take everything it tells you, because I don't want you to harm yourself, or it isn't perfect. It can mislead you. You're not saying don't use it because they're going to, just like the internet. They're going to use it. Just help them understand how to use it for their good and their care. Okay, especially with teens. Wow. Especially with teens, they can be so lonely sometimes. We just have to recognize that. You go, well, I'm glad. You can create your own persona and name them. So we have to ask: Is your best friend now a machine versus a human? We have to know that. So we just take, it's just straight up what we have to do to find out what that use is. And don't think it's just kids, okay? Adults do it more than the kids do, I've found. I like to do couples therapy. I'm one of those idiots, okay? Oh, it's fun, but you have to like what you're doing, otherwise you don't do it. Anyway, I had a couple years ago who divorced because he was addicted to gaming on the internet. Now I got a divorced couple because he had an affair with a chatbot. New world, okay? It's here. It ain't going away. And we know there's challenges because of the way people use it. And they don't know that they're using. It's like some people just don't know it. So we have to know what we know to help them, okay? And we don't use it wrong, okay? So again, therapy bots can actually be good because you could extend yourself. You want to have an avatar of yourself? Yeah, you can do that. And you can talk to your patient between sessions. Wow. And we all know therapy doesn't just happen in the room, right? It's what happens in between, so a lot of times more important than what happened in session. And we know they need to practice skills. It can help them do that. Some of the research now shows there's better outcomes when employed that way, which is really, really promising to me. It's like, wow. Extend the care reach that we have. We don't have to depend upon just the way we've always done things. Of course, I know some of my colleagues we've never done that. Sorry, all right, never mind. Anyway, but so there's that use of it too. So again, look at the other side that we're challenged to do. Okay, this is my crude representation. This is not a generated one. This is just my own. Show you the difference. Like I'm not too imaginative. Okay, if you probably can't read that from back here. Ooh, golly, that's really bad. Okay, sorry. All right, I put 2 axes here. Of course, that's the stat side. But anyway, what you're doing with the client safety, what is being done, okay? So when you're doing challenging is thinking of ethics. Artificial intelligence, what's ethics? What's ethics? Why do we talk about ethics? I'm sorry? To do no harm, yeah. Rules, guidelines, yeah. I call ethics, ethics stands between the rules and the law and what we actually do. That's my integrity to take the guidelines and go, how am I doing this with my patient right now? It's in that gap, okay? So what we're doing, the risk to the client, and what we're doing. If it's just administrative tasks, good Lord. If you're in a hospital, AI can do prior authorizations and claim stuff much quicker than humans. Let it. To me, it's kind of like, that's the best thing about computers all along. Good Lord, if a calculator can do it quicker than I can, I do use a calculator. Okay? So the repetitive tasks that are boring and we can't find people to do, we need to free people up to do better jobs and pay them for that, rather than just sticking them over here and go, oh yeah, I'll count these things, 1, 2, 3. I mean, that's boring. People don't want to stay in those jobs. They don't need to. Let the machine do it. It's repetitive. That's what it can do well. Let it do that. Free people up to do better jobs and more engaging and challenging jobs that are more rewarding. Okay? Let it. That's low end. Now, you still have to have the safety protocols because you don't want it denying claims should have been paid. Who programmed that thing? So somebody does have to make sure that it's not, oh, you live in a certain zip code. Denied. Zip codes are proxies for racism. Machines like numbers, so it uses a zip code, and it's a proxy for racism. We have to know that. Okay? Pure and simple. The way it works. It is based on numbers, so if you're using a number that divides us or separates and discriminates, got to have something to deal with that. Even on the lowest end of this, okay? The lowest end. Don't forget those things, okay? Move up is kind of like doing intakes, data collection. I don't know about you, but I hate to go to the doctor's office and fill out that friggin' paperwork every damn time, put my name on it. Pain in it, You know what my doctor has now? And I know it's an AI system, they just don't tell me. I get a text with a link, and I go, tick, 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 pay my copay, and when I get to the doctor's office, I check in. I don't have to get there 3 hours and wait there. Fill out the same paperwork 14 times. I just wish they'd quit asking me the same questions over again. We could do that. Could you, so that we bore our patients to death sometimes with our paperwork, don't we? And we sometimes discriminate with our paperwork. It's another one of those things. Take a look at that, okay? Again, automating those kind of things can help with our patient intakes, can help with the challenge of bringing people in. And they come in, they come in for services, they don't come in to fill out paperwork. And well, it's not our job either. I mean, how many of y'all in MSW learned how to do paperwork? Is that your goal? Thank you. Wasn't mine. Became part of the bane of the work. We do, but if we automate some of that so that it helps us, so we have more time to spend with our clients, golly, that's great. Why don't we, think outside the box and do things that helps us with our jobs, helps our patients with access, et cetera. Data collection, it can pull together data from all kinds of sources. Again, responsible use of the data, where's it coming from? Again, helping us know what is best for our patient. And never, oh yeah, it's a score. I'm going to follow that. No, yeah, that's good, thank you. Kind of treat it as a good hypothesis. Everybody knows about what a hypothesis is, right? Research. Maybe that's the best way to approach what it gives us. A good hypothesis. Test it. Okay? All right. Claims and all those kind of things, documentation, help you write your note. Golly, those things are good. Like you were telling me about the blueprint, or was it Brandy? Telling me about an agency that y'all work with that uses blueprints, and one of those programs that helps you. It listens to the session and then writes a note for you. That's a game changer. I mean, whew, it's like. And it can sometimes, one of the things that I like about it, it helps me always include medical necessity to get payment, because it never forgets that. It's programmed to put it in there. I sometimes forget. I'm writing, I'm trying to get it done so fast I forget. And then you get audit. Anyway, it helps you do things. Let us use those helps to help us along the way. Case management kinds of stuff. It can give you overview of a client. I was telling somebody last night, it's like one of my patients years ago, I go, do you know how many times you've been to the state hospital? This is in Kentucky, not here. So. And he goes, oh, no, I don't know. He's, lives with schizophrenia and other kinds of issues. And I said, well, it's 46. I said, how did I know that? I had to go back to the record and count them. You know how long that took? I didn't get paid for it because I had to do it on my own time. Going back through the record to count them up. The machine could have done that in 2 seconds. But it helped him because I said, how can we avoid number 47? And he had a pattern of when he went to the hospital. And what did that tell me? I'm missing something. You have a pattern. It's every 3 to 4 months. What's going on? He didn't go back to the hospital because I had to dig into the record, but the machine could have done that in 2 seconds and helped me with that care quicker than and probably could have fit earlier on because it would have identified the pattern. I had another patient who came into the crisis unit every year in November. Of course, I didn't know that when we first started. It was the third year I'm going, let me check on this. I was like, yeah. Made it roughly the same date the previous 2 years. What's going on? Found out a history of trauma that nobody had identified before because nobody knew the pattern. Machines are good at that. Let them help us with that to help our care. Challenges. Anyway, client monitoring. Has anybody got a smartwatch? Who's got a smartwatch? Oh, good. Do you use the heart rate thing? Okay, all right. Anybody else? Of course, yeah. All the steps, yeah. And the circles. Okay, all right. You just want to make sure. Okay, the full 9 yards. Okay. Which is good. We can do that. There are sensors that can sense mood. Yeah. It tells you to stand up, walk around. Helps you with that. But it also person can report to you, I'm feeling particularly down at this particular moment. On a scale of 1 to 10, I'm a 2. Whoa. If I knew that quickly, yeah, the mood fluctuates. We know mood fluctuates, but we don't know that pattern for our individual patients. Wow. That is, to me, challenging and enticing that we could, if the patient wanted to use that kind of a system. There's even one else. See, my biggest thing is that, I've worked a lot with substance use disorders, so I've gone, I wish I could smell. Not just for substance use disorders, but also for my other chronically mentally ill, because sometimes people with schizophrenia don't do good hygiene. They do have one now that looks promising to do smell. It's like, wow. Whew. I don't know if that'll go to work, but it might be a help. But again, other kinds of ways to monitor our patients that can identify patterns that can help us in their treatment and care. Wow. That could be really good for outcomes. And again, that was the hardest part about mental health. In mental health, anybody can come in the front door. And so some days we were just overloaded with clients, new people, or people who we hadn't seen for a while, or whatever. We only had so many staff, and people get burned out easily because of that ebb and flow. So, you have to manage that with staff and yourself, but at the same time, it limits other people coming in because the capacity is overrun. So if we could have better outcomes, access to care would improve too. Challenges. But anyway, as we go up the scale here, it's kind of like doing therapy. We talked about the chat bots and stuff. How might we do doing care plans, diagnosing, and decisions. It's higher risk as we go up. Okay? So ethically, how do we do that? How do we balance that? How do we do that? That's the real challenge for us to do. And it's going to be done as a group. I won't be able to decide that on my own. It's going to have to be done in care teams and agencies, and we're going to be working with people who probably have no clue and sometimes don't care what our ethics are. Okay? So we have to, we'll be in that kind of thing. But anyway, the risk that we have to keep in mind as we deal with all these different levels. Anyway, make sure I'm not going to run overtime on you. Sorry. I know you're on schedule. So some best practices and guidelines for you. I think you probably already know all of these, and you could probably list a lot more. Another nicely AI-generated slide for you. Okay? So it's like inform our clients, make sure they know how we're using it, that we understand the technology, and we're trying to use it the best we can for their care. And this is how it might help them. Have disclosure statements, have informed consent. They're longer now than they ever used to be, but anyway, it's part of it. Do it in good, plain language. Please don't have an attorney write these things and give it to the client and expect them to understand it. Do it in a conversation. Be human about this. Okay? Agencies sometimes get real anal about it. So we have to kind of help them with that part of it too. Needed to have larger print on this. I can't even read it now. Be transparent, with what with your use. Keep that human element in there. That's us. How to decide to use it. That's us. That's our critical thinking. That's our challenge. That's our reasoning. That's our ethics. That's our values. Keep that in there. Don't ever let agency put that outside. Confidentiality, make sure you're protecting that, obviously. keep doing these kind of things. Hope I didn't bore you today, but anyway, this is part of your literacy in AI. This is the biggest challenge. We have a kind of a voluntary system in the United States about this. Europe went the opposite way, and they require it. Kind of mandatory over there come as they fully implement the AI Act. I don't know which is better. I'm just saying it's a different approach to make sure that the average, people like us understand what we're doing and using it. So it's a literacy thing. Keep up with it. This is going to change and change and change, but the basics will still be there. Okay. Keep your competency. Look, always question for bias. Always. Okay? Data is not neutral. It just isn't. It's collected from somewhere, and it can have all kinds of stuff in it that just creates bias. We don't need that anymore. We've had our fill of that, I think. Our hope to know the difference so that we don't discriminate between groups and peoples and whatever. Like if you have a credit score this way, you don't get a loan. It's used in financial systems too, so like that. So we want to make sure that we're looking for that. There are systems that conduct fairness tests, diversity. Oh, that's a bad word. I shouldn't say diversity anymore, should I? Sorry. Say diversity. Making sure that we keep that fairness in there because of equity. And again, not forgetting that there are people who are not going to be able to use this. Respect them for doing that so that we're not forcing technology on them that they don't want. We may think it's a great thing since sliced bread, but they don't. Respect that. Respect that difference and that challenge for us. All right. Made it for you. I was timed this to be ahead, so.
All right, a few announcements, and then we are going to let you guys have a break and find your way down to the sessions. First of all, everybody, another round of applause for Hank and his willingness to travel up from Kentucky and share this information with us. It was very valuable. Again, if you have questions, he volunteered to do open Q&A, so bring it. He's ready, and he's got all the education, and he's a great resource for us to have in this community today. So he's going to be here throughout the day at the conference. He may step away for an hour because I think he's got a meeting, but you can probably find him milling around too if you don't get your chance in the Q&A if it gets super popular. And he is so knowledgeable to talk to. I got to spend the evening with him yesterday at the mixer, and it was fantastic. So make sure that you visit the exhibitors. They're down there where all of the conference sessions are. I'm terrible with directions. Am I pointing the right way? That way. Don't ask me for directions, but it's that way, and the exhibitors are all down there, and you're welcome to kind of stop, ask them questions, pick up material, do the networking. Make sure that you return to Carter Hall for lunch at 11:30. Following the end of breakout session 1. There are going to be 2 lunch lines this year. There will be a lunch line where the breakfast line was set up, and then last year there's room off to the side, I think it's 216 or something like that, that will also have lunch set up there. So if that line is massive, make the other line function too, and we'll have people to direct you, because we're going to try and get everybody in better this year than last year because we had a little bit of a bottleneck at the lunch line. So there's going to be 2 lines to get lunch from when you guys come back. I think it's 226 and 227. CEUs, for those of you that have paid for your CEUs or have not paid for your CEUs, you will need to do the surveys that will come out at the end of the day in your email within 30 days to get your CEUs and claim them. And they are $25 this year beyond the conference, because I know there's a lot of people here who don't need the CEUs, but if you need them, you need to go pay the $25. Do these surveys within 30 days of the conference, and then you'll get your CEUs. You're going to hear that every single session because we want to make sure you get your CEUs if you need them, guys. So I just want to make sure and reiterate it here. And with that being said, I'm actually letting you about 5 minutes early to go network and go look at all of the stuff and find your sessions. If you're going to theater, it's down the stairs, down the elevator, on the bottom floor, and across.